Good afternoon again, everyone, and welcome back if you've been joining us already, and welcome to those of you who are just joining us now. This is Heather Drake. I'm the membership manager for the Maine Public Health Association, and this is our 2020 annual conference. So we're excited to be here this afternoon with Doug Dunbar, who will continue our conversation around opioids and substance use disorder. A couple of reminders before I introduce him to please complete the session evaluations, which are located on the session page where you logged into this event. If you've forgotten to complete any evaluations, you can go back and complete those. And we do ask that you do so not only for our benefit so that we can provide better events for you in the future, but also for our speakers. And it is required for anyone who's seeking continuing education credit. So please do that. As we go through the presentation today, you do have the opportunity to ask questions of Doug. We'll take those at the end of this session, but you can ask those by using the Ask feature that's located on the website and in the conference app if you're using that. So we encourage you to ask lots of questions and interact as much as you can. And with that, I would love to introduce Doug Dunbar. He is a workforce development specialist with the Eastern Maine Development Corporation, and he will be talking with us today about the programs that they're working on. So we're excited to have you here, Doug, and thank you so much.
Thank you, Heather, and thank you all for being here. And I'm glad Heather mentioned questions because that's really important to me and to the work that I'm doing and that we're doing here at Eastern Maine Development Corporation. So please, I encourage you, if you have questions or comments or suggestions, advice, criticism as we go along, feel free to share that because even though I can't see you, I would really like this to be interactive. I give this presentation somewhat regularly, and because of that, I've sort of tightened it up, and so it may not run, the full hour. So your involvement is really critical. So I asked earlier what you have, some of you have been learning about in previous sessions, and I know some of it has been research about isolation and how that impacts people with substance use disorders. Uh, that's really important because that's related to what I'm going to talk about and how connections are so important for people with a substance use disorder. And I know this personally because I have suffered for many years with alcohol abuse. And I'm going to tell you a bit about my story because I think stories are critically important, really essential in making progress around stigma, around misconceptions. And I just think stories can have a much more meaningful impact than hearing endless news reports about another overdose death or how overdoses in Maine increased nearly 25% in the first quarter of this year over the fourth quarter of 2019. How 2018, we finally saw a reduction in overdose deaths, but last year they rose again. And of course, this year, because of the isolation caused by COVID-19, Maine and the nation, as I'm sure you all know, is on a tragic pace to set all-time records. But we hear these figures, and unless we know someone personally impacted, I think our eyes just to start to glaze over at statistics. So stories, to me, uh, make a difference. They do for me, and I think for many other people. Let me tell you how I came to this work. From my earliest recollection as a child, I suffered from two mental illnesses that I couldn't tell anyone about. I had loving parents, two terrific sisters. They were older. They picked on me a little, but it was it was a very good upbringing. grew up here in Bangor, but I couldn't tell my family nor my friends, no one, that I suffered from obsessive compulsive disorder and anxiety disorder. And this was a secret I kept for most of my life. This was how OCD manifested itself in my life. Just to get out of bed in the morning, I might have to get up, go back into bed, roll over a couple of times, get out again. If it didn't feel right, I might do that 20 or 30 times just to start my day. And then I'd go into the bathroom and I might have to step in and out of the shower 20 or 30 times with the water splashing on the floor. I might use a half a bottle of shampoo one time in the shower. I gave that whole rinse and repeat thing, rinse and repeat, that you see on the back of the bottle. I gave that a whole new meaning. I might use a half a bottle at one time. So that was my day, pretty much every day, and I just dealt with it. I had rituals and routines and prayers that I said to cleanse uh, thoughts and feelings. OCD is fascinating unless you suffer from it. It just was my life, and um, I just put up with it. I somehow graduated from high school, John Babster in Bangor, from Holy Cross College in Worcester, Mass. I even got a master's degree, and I don't know how I did that because reading was always tormenting as well. I would read a page in a book, and then I'd read it 8 more times. And I'd turn the page and I'd feel like, oh, I got to go back. And so I'd go back to the first page and I'd read it again 8 times. So through school, I maybe read 25% of all the work assigned. So I have no idea how I graduated and eventually got a master's degree. But that was my life until September 11th, 2001, when the terrorist attacks occurred. By this point, I had become Congressman John Baldacci's communications director in Washington. And on that day, which I'll never forget, it was a beautiful, sunny DC day. My OCD and anxiety went out of control, just spiraled out of control. I could barely move without having to repeat each step. And we stood outside on September 11th, right next to the big domed building where we thought the next plane was headed. We could already see smoke billowing up from the Pentagon in Arlington, Virginia. And this was just too much for me. The next day, I went out to dinner with a coworker to my favorite little restaurant, which is no longer there, sadly, the Little Fountain Cafe on 18th Street in the Adams Morgan neighborhood of Washington. And we drank a lot of wine. And I was not someone who regularly kept alcohol in my apartment. I drank occasionally, but I didn't like the taste. So it wasn't something that I was really accustomed to doing regularly. But that night or the next day, I realized this will be my medicine. I can't tell anyone that I suffer from mental illness. And now I have found something that will help me. And it did. For many years, my self medicating helped me to manage through life. I didn't have to drink much because my tolerance was low. So the quantity, wasn't excessive. And the frequency was just when I really felt I needed it. But over time, with increasing tolerance, the quantity increased, the frequency did as well. I soon became an alcoholic. I didn't realize at the time that if members of your family or extended family suffer from alcoholism, you may be perhaps genetically predisposed. But I quickly became an alcoholic, and I should have realized that a number of cousins and uncles were alcoholics in my extended family. So as time went on, no one knew still about the mental illnesses. They didn't know about the self-medicating. They didn't know I'd become an alcoholic. And my career uh, progressed to the governor's office, where I became John Baldacci's press secretary. And then I was asked by then Secretary of State Dan Gwiatkowski, a terrific public servant who we lost at a very young age. He asked if I'd come to the Secretary of State's office and be Maine's Chief Deputy Secretary of State, which I did for several years. And during that time, I had to deal with a lot of people who lost their driver's license because of an OUI and they wanted it back. And they would come to me and I would have to explain, the law doesn't allow you to get your license back at this point. And I tried to be empathetic. I had not had any encounters with law enforcement by this point, but I knew I was drinking way too much. And I probably knew I was an alcoholic as well. And I would counsel these people who would tell me that they're going to drive. I'm going to drive anyway. I lost my license, but I've got to get to work. And I would say, oh, don't do that, because if you keep driving, you'll get an OAS, operating after suspension. And then if you keep going, you'll get an OAR, operating after your license has been revoked. And then if you keep driving, you'll become a habitual offender. And I tell you that because I became the poster child of what happens when you allow these things to snowball. So as time continued, I had my first encounter with law enforcement about 9 years ago in southern Maine. I was stopped for an OUI. I thought for some reason the world would find out. I had had interesting jobs. I was the congressman's press secretary. I ran all of his campaigns for re-election. I was the governor's press secretary. I was Maine's chief deputy secretary of state. So I figured, I know many reporters in Maine. Someone will find out. There'll be a news story out, and I will lose my career, and my family and friends will find out. But no one did. Not on my second arrest, or my third, or my fourth, or my fifth. I became very skilled at bailing myself out of jail, at explaining away why I was late or didn't come home on a particular evening. Not until my sixth arrest in October of 2017, just about exactly 3 years ago, did it all come crumbling down. At this point, I was a deputy commissioner at a different state agency, and I had to resign my job. I went to jail for 136 days. It was the most fascinating and transformative period of my life. After the 136 days in jail, which by the way is 3,400 hours if you're keeping track, or 20 weeks, or 4.5 months. After that period, I entered the Penobscot County Adult Drug Treatment Court. And I spent 15 months in drug court, and I'm holding up my prop, which I carry every day. It's a heavy, nice coin with a state seal on both sides. And you get this if you graduate from a drug court in Maine. And I carry it every day as a reminder of what I've been through. I have 2 felonies now. Whoops, and I've just changed my slide. I have 2 felonies now. And that relates to the work that I do. I was fortunate, very fortunate, at age 50 and going through drug court. A friend of mine, a good friend, Lee Umphrey, had become the president and CEO of Maine Development Corporation. And he knew about my new passion for helping people in recovery and those re-entering from jails and prisons. During those 136 days in jail, I kept thinking, who is helping these young guys? I was the old guy at age 50. And most people in jails, as you probably know, are in their teens or 20s or early 30s. And I just kept wondering, who is connecting these people with the resources that are out there? I didn't find myself surrounded in jail by hardened, lifelong criminals who were evil to the core. I was surrounded in jail by people who were sick and who were poor. And that's another issue. We incarcerate so many people in our jails who are poor. They can't get out because they can't come up with a modest amount of money for bail. But that's a topic for another day. The people who surrounded me in jail needed help of one kind or another. I did, and they did. And I kept wondering, how are they ever connecting with services? Many of them even wanted help, knew they needed help, but because of life circumstances and Um, and because we make connecting with services too hard sometimes. They didn't know where to turn. I would write notes to people who were getting released. I'd write down a program or an agency or a person that I know and give it to the inmate and say, please, please look into this. So I was fortunate that Lee Umphrey here at EMDC said, Doug, why don't you come work for us? We have an economic development division that focuses on workforce issues, and we help people who are in recovery, maybe people who have been incarcerated, and other folks with different life challenges. We help them to get into education, training, and ultimately meaningful employment. And we provide supportive services to help them along that journey. And then even when they get the job, we stick with them to make sure that it's going well. And I said, sign me up. And Lee said, we'll even pay you. And I said, well, that's even better. So I'm blessed to have a job because too many young people, if they have a felony because of drug possession, because of alcoholism, it is so, so difficult to move forward in life. People carry around their criminal record like a ball and chain for years and decades, and it weighs them down, even if they've completely transformed their life. And part of my message today is we have to do something about that. There are studies, there's research that shows people in recovery from a substance use disorder can be some of the most productive employees you'll ever have. They're more uh, productive, uh, they use less sick time, and they can be outstanding employees, but not enough businesses and organizations will give them a chance. So, with all that said, one of the first assignments that came my way here at EMDC was to help write a grant proposal. In 2017, the US Department of Health and Human Services declared the opioid crisis a national health emergency. Thank goodness. Overdue, but thank goodness that it happened. And that made various pots of money available to states who could prove that there was a crisis in their state, and of course there's a crisis everywhere, and two, that they had a plan to address various aspects of the crisis. So the US Department of Labor started to make grants available to states to address the opioid crisis from a workforce development perspective. So the Maine Department of Labor came to EMDC and said, hey, will you help us to write this grant proposal? And I had been a writer throughout my career, had never written a grant proposal like this, but I became the writer of this. And it was such a blessing because when I was in drug court, I learned so much. And when I was in jail, so much about other substances that I knew nothing about. This is how ignorant I was. I got to jail, I soon saw so many people who were missing teeth, young guys in their 20s, missing teeth. And first I thought, wow, these guys have got into a lot of fights. They've been beaten up. Look at that, missing teeth. Finally, I spoke up quietly to a friend who I had met in jail, and I said, why are they missing teeth? And he explained that drug use can cause this to happen. I had no idea. The clincher for me to join EMDC was when Lee and others were telling me about the supportive services that are available to participants in our workforce development programs. And somehow it came up that EMDC has helped young people get dentures so that they can move forward, have the confidence to attend an academic program or apply for a job or accept a position. So when I was told that they can get help with dental work through EMDC's programs, I was all in. I was all in. Um, so again, during drug court, 15 months in drug court, I met so many people who would have been dead without Narcan. I learned about young people age 12. There was someone in my group, age 12. She began using very powerful substances with her parents, and she thought it was perfectly normal, age 12. So, opioid uh, problems really stuck with me after my first IOP session at Wellspring here in Bangor. It's a substance use disorder treatment agency. And there had been something in the news about Narcan. A previous Maine governor was being critical of Narcan. And so I came to the IOP class that day and I said, you don't have to answer this question, but have any of you, do you know of anyone who's ever experienced Narcan? And there were 10 of us in the room. And I knew one other person was there because of alcohol like me. Of the other 8 people, all 8 hands went up. And they began talking about it. Yep, I've, I've been Narcaned. It's been used on me 2 times, 3 times, 4 times. And these were all young people. And I realized they all would have been dead. These beautiful, wonderful people with incredible potential all would have been gone. Today, the young woman who started using heroin at age 12 with her parents has 2 beautiful boys. She's been in recovery for 2 years. She's an amazing mother. Others in that group, one owns a business today. Another is an artist. And the list goes on, and they all would have been dead. So when I was asked to write this grant proposal to seek help from the federal government, I thought it was sort of a blessing, something sent down to me, I guess. So we submitted the proposal, the Maine Department of Labor and EMDC, last fall, about a year ago this time. And then there was silence. So I thought, well, we're not going to get the money. And just about the time COVID arrived, our funding arrived. We were awarded $6.2 million for the statewide effort. And COVID slowed us down, the rollout of this initiative. But we've gotten over some of the issues that COVID presented, and we are now well underway into Maine's Connecting with Opportunities initiative. And so now I think I will move forward with the slideshow. Thank you for listening to my story, because again, I really believe there's power in stories. When I was in jail, I didn't know what I would have when I got out. I knew that my past career in government was over. I knew that my finances were going to be a mess. Fortunately, my family hadn't abandoned me because they knew nothing. They knew nothing. In fact, one of my sisters, the first time I called her from jail, she said, Doug, I didn't even know you drank much. I was meticulous. Maybe it was the OCD. I was meticulous about hiding everything. So when I was in jail, I thought, I don't know what I'll have, but I'll have a story. And it's about time I tell it, because keeping secrets, hiding what we're going through, is almost never helpful. It's almost always a terrible strategy. So I tell people now, if you can, and not everyone can, but if you can, tell your story. We need people to recognize the face of mental illness. I'm the face of mental illness. I'm the face of addiction. I'm the face of a criminal. I'm the face of a felon. But we need to tell people our stories if we can. And yeah, I think that that is so important. So thank you for bearing with my story. So Maine's Connecting with Opportunities initiative is here. It's hopefully bringing hope to many individuals. I know it is. Well, welcome back. Welcome back. It's a windy day here in Bangor, and we're located across the street from Bangor City Hall on Harlow Street, and the entire neighborhood apparently went down for about a minute or so. I don't know where we left off, but thank you again for listening to my story. Stories are important. Encourage people to tell them. We need to reduce stigma and misconceptions, and just be able to recognize that addiction, that mental illness is very prevalent and can impact anyone from any walk of life. And on this second slide, again, I don't need to tell you, you're the experts, I'm sure, or you just know well that Maine has been profoundly impacted by the opioid crisis. In category after category after category, Maine ranks in the top 3, 5, 10 for worst outcomes. We rank high on lists that you want to rank low on, or lists that you don't even want to be on. So, as I said earlier, and as you know, overdose deaths declined in 2018, but they rose again last year. And sadly, because of the COVID crisis, because of COVID, we and all states are on pace to set tragic new records. The first quarter of this year, as you know, the state reported that overdose deaths rose by 25% almost over the fourth quarter of last year. And again, last year wasn't terrific. Overdose deaths increased in 2019 over 2018. We know that more than 80% of overdoses involve an opioid. So this crisis is out of control. EMDC, we've worked for years with individuals in recovery. In fact, we've had a special sort of workforce development project with Hancock County Jail and recovery organizations in Ellsworth since 2016. And as I said last year, EMDC was approached by the Maine Department of Labor to help write this grant proposal. It was awarded early this year. And as I said, it's providing training, education, and employment service to individuals impacted by OUD and to others who want to go into a profession that we hope will diminish the overall crisis. Let me tell you who can participate. And as I go along, I hope you might start to think about people in your organization who should be aware of this, or individuals in your life, a cousin, a niece, a son, a parent that you know who could benefit from this. So I hope you're thinking, and again, I hope you'll send some questions my way or comments, or tell us how we might be able to do this better. The pot of money at the US Department of Labor that is funding this initiative is dedicated to unemployed workers, those who are dislocated through no fault of their own, and individuals who are long-term unemployed. Long-term unemployed means you haven't worked for 27 or more weeks, about a half a year. Dislocated uh, means perhaps the business you were working for downsized or closed. There are many reasons that someone can be a dislocated worker. You know you're dislocated if you are eligible for or are receiving unemployment benefits. And frankly, this year, because of COVID, there are many, many dislocated workers. So if you're dislocated or long-term unemployed, you're eligible to participate in this initiative. And there are two tracks, as it says on the screen. Track one is for someone who's been impacted, either personally or indirectly. Indirectly means that someone in your family, a relative, a close friend, has been impacted personally, and so that has impacted you indirectly. As long as you can honestly say to us, yes, I've been impacted, that's all we need to know. We don't ask any other questions. In my case, for example, I have never used an opioid, legal or illegal, but I have a nephew who struggled for 12 years with all sorts of substances. Fortunately, he's been in recovery for about a year, but I could honestly say, yes, yes, I've been impacted. There were so many nights that my family knew my nephew Nick was using and sort of out of control. And you would go to sleep at night thinking, is this the night that we're going to get a call saying that something went terribly wrong? So my family has been indirectly impacted by opiate use for sure. Track 2 is for people who have not been impacted. They can't say they've been impacted by the opioid crisis. In this case, they're still eligible as long as they're unemployed, but they would need to focus on a profession that can help the crisis generally. So it might be a substance use disorder treatment field, a mental health field. Maybe they want to become a recovery coach and work in an emergency room. So the career opportunities are more limited, but it's very focused on the crisis. On track 1, there's a full range of career opportunities available to you. Pretty much anything you want to do, as long as there are jobs. We probably won't support someone if they want to become a philosopher. There just aren't that many street corner philosopher jobs out there. So we probably couldn't support someone uh, in that line of work. But generally, all career options are open to the individual. So when someone participates in this, we do a few assessments to see if they need help with reading or math. Primarily, that's what the assessments are for. We also have a couple of assessments to help the individual explore their interests and to identify skills that they may not be all that cognizant of. Then we develop an individual plan, case management services that go along with the plan. And really importantly, we have hired peers, people in recovery from opioid use disorder, to partner with each participant and to help that individual every step of the way. So many who are participating are in an education or training program. They want to be a welder, they want to be a nurse, and so on. So we support and pay for those programs. Sometimes, in addition to an academic program, we place people into work experiences in businesses or organizations or on the job trainings where we pay EMDC through this initiative. We pay the employer to take this person on and to learn, hopefully, that this individual is going to be an excellent employee so that when the work experience ends or the on the job training ends, the employee, the participant in the initiative stays on, that there's a good match. And then we help individuals with with job placements in meaningful careers. And then we follow up and stay with that individual, for up to a year to make sure that they're doing well. And what can we do to help them to make sure that the job works out? In addition to all of that, there are various supportive services to help the participant. I think I mentioned earlier that we don't want people to join us and then be derailed or sidetracked because of life challenges. Perhaps someone's car breaks down. Well, we want to pay for that repair. They need a new laptop computer. Well, they need that to participate in academic programs and oftentimes even to interview for jobs. So we'll help with that. Maybe someone needs childcare. Um, we will, help to fund to cover the cost of that. So with each person, again, there's a plan that is set up. And I use this as an example, maybe because I was in the Secretary of State's office for years, but if somebody wanted to become a commercial driver, a truck driver, they would need to take the CDL course, the commercial driver's license course. So we put that in the plan. And then we realize that this individual needs help with reading to make that course, that CDL course, manageable. So we will enroll this person, say, in a 4-week remedial reading adult education course. Then we know this person needs a laptop because these courses now are more online. So we'll put a laptop in the plan. And we know that without childcare, this person really isn't going to be able to move forward. So childcare goes in the plan. And then there's a budget. We'll allocate so much money for the CDL course, for the reading class, for the laptop, for the childcare. So there's a plan and a budget. And then there's this team of people to be supportive all along this journey. As I've just emphasized, supportive services really can make the difference for people. Too often in the past, a lot of our participants really gave up when something cropped up, when a barrier presented itself. Well, we're here to be encouraging, to generate hope, and to take down those barriers and help the individual learn how to do that in the future. We're still looking for partnerships because we need to get the word out that we have plentiful resources. You don't hear this often, but we have money. We have ample funding to help each participant. And so we're looking for your partnership, perhaps, to spread the word. There's just a variety of types of organizations listed on the screen who we are partnering with at this point. And what do partners do? What can we accomplish together? Obviously, raise awareness that this exists, make referrals to us, and I'll explain how to do that. Um, Again, we've hired these peers that we're calling peer connectors. And our initial plan before COVID was to have the peers out everywhere, making presentations, going into treatment facilities and other places to spread the word. Now we're doing most of this remotely, but at some point we hope that the peers can actually uh, go on site and try to spread the word. And some of our partners work with us to collaborate with us to provide services to our participants. If someone needs help with reading, one of our partners is Literacy Volunteers of Bangor. So we might work with literacy volunteers to provide some support to a particular participant. The next step for perhaps you, someone you know, is to contact us, to make referrals, to send us questions and suggestions and advice and guidance. We have a dedicated email address. It's opportunitygrant@emdc.org. Um, my email address is ddunbar@emdc.org. So we are looking for feedback and referrals. And, you know, as with many projects or many issues in life, collaborations and partnerships are essential to really maximize what we're all doing. This is just a slide about our workforce program in general. And this is important because you may know someone who you think is eligible for the Connecting with Opportunities initiative, but they come to us and we find out that they actually worked for about a month in the spring. Well, unless that person is a dislocated worker, they might not be eligible for Connecting with Opportunities. However, at EMDC and our partner agencies in other parts of the state, we administer other workforce development programs. So if someone came to us and had been working, okay, they're not eligible for Connecting with Opportunities, but they make so little that they're eligible for another program. The main one throughout the country is called WIOA. It's an acronym, WIOA, the Workforce Innovation and Opportunity Act program. There's a youth WIOA program for people 16 to 24 and an adult WIOA program for those 25 and over. And it's also open to people in recovery, people with a criminal history, people who are challenged by other things in life. Maybe they never graduate from high school and just need a helping hand to take those steps. So I tell partners and anyone I speak to, just send people our way because again, if Connecting with Opportunities isn't suitable, WIOA might be. And then if we don't know of a program that we administer, and there are others, we may well know where this individual can get support and assistance. So thank you. And there's a disclosure slide that we were asked to to share. No commercial relationships. And so that is the end of the presentation. I'm going to go back to the beginning. I know I have to leave this on the screen, but I'll leave the title of the initiative on the screen. If you remember nothing else, remember Connecting with Opportunities and how connections are so important. And remember, we have money. You don't hear it often, but we have ample resources. And there's sort of a movement in recent years in the recovery community that says the opposite of addiction is connection. You've probably all heard that. connections are so important. And so that's part of the reason why we titled this initiative Connecting with Opportunities. And it does go back to my days in jail where I thought, oh my goodness, who is helping these guys to get connected? And that stuck with me. So one day the grant proposal needed a title. So Connecting with Opportunities is what we came up with. I'll stop there and see if there are any questions or criticisms.
Thank you so much for that presentation, Doug. It's great to learn about your program and just, how it's really meeting the needs and multiple needs of people who are seeking career opportunities, and reducing those barriers. So kudos to you all for putting this together and initiating it.
I just want to, the only thing I would say additionally while I'm thinking of it, my memory isn't as good as it was when I was younger, so I have to sometimes speak up when I think of something. We are planning, our estimate is to help 700 individuals throughout the state. We have about 100 participants so far, so we really need folks to sign up with us. There are no strings attached. There are no caveats. There are no fees. I've explained to individuals what we do, and at the end, one or two have sheepishly said, well, when do I have to pay the loans back? There are no loans. You don't pay anything back. We are just here to help.
Great, thank you. And we do have several questions that have come through along with several kudos as well. And thanks for sharing your story. I think people really appreciate that, as did I. One question that's come up about the grant is how long does it last?
Good question. As with any federal grant or grants in general, it's for a set period of time. And we are already starting to figure out how are we going to make it last beyond the 2 years. It's a 2-year grant. And again, we hope to serve 700 individuals at a minimum, but 2 years. But again, as many organizations do, we are trying to determine how to make this last. And one thing that we are doing that will have a lasting impact beyond the 2 years is that we are educating people in the workforce development world throughout the state about addiction and recovery and the various needs and supports that people might have, needs they might have. So we're trying to educate the people who are in the workforce world about addiction, the opioid crisis, and recovery in general.
Thank you. And another question came from Martha. She's wondering if the program is available in counties other than Penobscot, Hancock, Washington, and Piscataquis.
Yeah, yes, and it is a statewide effort. Every county is involved. EMDC is administering this initiative and workforce development programming in general in 9 Maine counties. That's why on the screen, I think the 2 logos for the Northeastern Workforce Development Board and the Central Western Maine Workforce Development Board, you can see their counties in dark color. The counties that we don't serve, and the way that I said we're involved with 9 counties. The 10th is Aroostook County, and we partner with an organization called ACAP, Aroostook County Action Program, to deliver these services in Aroostook County. It's the coastal counties, we call them, the coastal counties, from Waldo down to York. That's Waldo, Knox, Lincoln, Saginaw, Cumberland, and York. This program, this initiative is administered, and all workforce development programs are implemented in those 6 counties by Goodwill Industries, an arm of Goodwill actually, called Workforce Solutions. And if anyone contacts me at ddunbar@emdc.org, I will direct you to the person in charge of this initiative. You can also just send an email to opportunitygrant@emdc.org and say, hey, can you connect me with Workforce Solutions? I'm trying to help someone in Belfast or Portland.
Great, thank you. That's really helpful. And I do believe it. If we don't have it, I'll update it. But we'll make sure that Doug's contact information is on the conference website if anyone needs to reference that. We have another question, and this one's related to your personal story that you shared. Did you ever participate in Maine's deep classes for your OUIs, and if not, why? And if you did you feel as if it were helpful?
I could teach the deep course. I'm quite certain. I've taken it twice. Both times I drove illegally to the course and parked down the road. And I thought it was interesting and I thought it was beneficial. Having worked in the Secretary of State's office for years, I was generally aware of DEEP and what it offered, but I found it fascinating. I thought what you learn about decision making, what you learn about tolerance for alcohol, what you learn about being able to sadly function in a blacked out state, uh, was eye opening to me. So I thought it was good. It obviously didn't stop me from continuing to drink and drive, but I thought the content was good. Speaking of blacking out, this is how bad my alcoholism had gotten. Toward the end, maybe 3 years ago, 3.5 years ago, before I went to jail, my boss, the commissioner of a department, she's still the commissioner of a state department, would send me a message in the morning. This happened a few times. And she would say, Doug, could we talk later today about that message you left on my phone last night? And I would race to my cell phone and look, and oh, there you go. At 3:22 a.m., I called my boss. Fortunately, I always called her work line and not her home phone or her personal cell phone, but I would have absolutely no idea that I had called. So those were difficult conversations to have with her later in the day when I cannot remember that I even called her. So yeah, deep was interesting. I learned about how you can sometimes function even when you're blacked out. There was something else I was going to say, but I don't know what it was. About my own story, though, what I left out, and this is really important, is just before I went to jail, not long before I went to jail, I finally hauled myself into a mental health counseling agency quietly. Didn't tell anyone, of course. And I started meeting with a counselor, and she and I very quickly understood that I would need medication for my OCD. It was lifelong and it was profound. In fact, she wrote a letter saying that my OCD was as profound as any she had encountered. So I began, I also started seeing a psychiatric nurse practitioner who put me on a couple of medications for OCD and anxiety, and they work wonderfully. The goal was that I would stop drinking when the medication started to work, and I just couldn't. I was an alcoholic and increasingly a terrible alcoholic. The things I did, the stories I could tell, you become a different person, through addiction. I sure did. Thanks.
Yeah, thank you again for sharing and especially being so open about mental health and your experiences. I think that's really important as we continue to have conversations about both mental health and substance use disorders. Um, and again, we have another thank you from the audience. This one's from Brendan for sharing your story. This one's a bit specific to the work he does, but I think it's one that is probably on everyone's minds. Brendan is a member of the Western Maine Addiction Recovery Initiative, and he says it would be great for his group to hear about your program, as their members include recovery staff, substance use disorder counselors, the district attorney, law enforcement, etc. How would they go about making a connection like this to enable you to come to their group and share perhaps your story, but as well as the program?
Yeah, just contact me. This is the work that I do through this phase of the initiative. My role is outreach, promotion, relationship building, spreading the word. So I'll meet with one person or as many folks as we can get onto a Zoom call, a Zoom session. I met last week with folks from FedCap. Some of you may know of the organization, and I thought I was going to speak to two or three people, and there were 85 staff members there. So Um, I'll go anywhere through technology. And yeah, we really want to reach uh, professionals and their clients. Sometimes it's more effective when I speak with actual clients. I spoke with folks at the Wellspring Women's House, for example, the other day, and I've heard from a couple of people since then. So sometimes that's more impactful. But I'll speak with anyone.
Great, thank you. That's good to know. And again, I'll make sure that Doug's email is accessible for everybody. And again, I'll just share, we have another thank you from Anne. She was the one that asked the question about DEEP. She says, your story is inspiring and the work you are doing now is phenomenal. And she really hopes you make your goal of helping 700 people.
Well, at least this proves that I didn't put everyone to sleep. I was worried when I logged on because I can't see you. I asked Heather and others to let me know if you all left the room or you all fell asleep. So these questions or comments at least prove you didn't fall asleep.
Right, exactly. Everybody that's here is paying attention. Um, and so just a reminder, if you have questions for Doug, to please use the ask feature and we'll make sure that he gets to them, as we do have a few more minutes. But as people are typing them in, uh, how has this, you did say you got slowed down a little bit by COVID, as I think all programs did and organizations across the state, but has that impacted the trajectory going forward, or enabled you to do the program for longer?
Well, we believe that we'll get an extension toward the end of the 2 years, but we've caught up pretty quickly. We have been very aggressive about trying to get the word out and registering as many people as possible and moving them through the registration process uh, very quickly. I have coworkers who are excellent at taking care of that. Um, but we have to report quarterly to the federal government about our progress. So we really need people who uh, want a helping hand in this regard to come see us. Um, I speak regularly to drug courts in Maine, and that's one of our primary partners. Um, I speak regularly in these drug courts, and I emphasize that this is real help. Uh, you know, this is a way you can move forward. We're not a staffing agency. If you needed to work yesterday or you need to work tomorrow in the Bangor area, I say go to Workforce Solutions, not Workforce Solutions, go to Complete Labor or Manpower or one of the staffing agencies. But if you want to, um, take steps toward a meaningful job, a meaningful career, work with us. We can also help you to get a part-time job if you need to go to school or want to go to school, but you need to support yourself. We'll help you to try to get a part-time job too. So every individual's case is different, and we have a lot to offer. Drug courts, by the way, um, I guess probably like various aspects of the mental health and substance use disorder um, arena, not the right word, but you know, drug courts deal with mostly with punishing and keeping people on track. But what they lack are sort of the supportive services to help each participant um, make make progress in their life. Drug courts are not for everyone. It worked for me. I needed that structure, that oversight. Um, but drug courts and treatment courts in general, specialty courts, they really lack supportive services like we are now offering. People in drug courts at some point are supposed to be seeking employment. People on probation, as I was, are supposed to be seeking employment. But now we're partnering with probation offices and with drug courts and others to say, okay, now you've got some resources too.
Thank you. It's wonderful to hear of that partnership, so that courts become rehabilitative as opposed to just doing the punishment.
Yeah. If you have 3 more hours, I will talk with you about our criminal legal system, which I no longer call our criminal justice system because my eyes were open to the fact that there is so little justice for so many people in the system, including victims of crime. So I call it the criminal legal system, and I'm trying to make up for lost time, both in my professional life and in my free time, to advocate for reforms. Going to jail for 136 days opened my eyes to vast inequities, injustices, and problems that I never knew existed. It's astonishing. I'll I won't go on long, but I'll just say that I believe anyone who's involved in the criminal legal system at all, a legislator who makes laws, a defense attorney, a district attorney, ADA, anyone, judges, everyone should go to jail for at least 2 weeks. And I don't say that to be funny. I just believe we would have a different system if everybody involved experienced what it's like and that they talked with other people, if they listened to them and heard their stories and understood why they were in jail and talked with the employees who work in jails. Everyone should go to jail for 2 weeks.
Yeah, I think in a lot of instances with work, we all need to take a moment to step inside the shoes of the people that we're providing direct services to and really
Yeah.
understand. We have, I think, time for one more question that's come through. This one's from Brendan. He asks if you're working with the Department of Opioid Response to build a picture of which jobs in the recovery treatment support field are most needed in the state right now.
Yes, the first part of your question, I don't know if you're speaking of Gordon Smith and the Governor's Office on Opioid Response, and perhaps Roland Robinson, who works at DHHS on some of these issues. We worked closely not only with the Department of Labor on this grant proposal, but with Gordon Smith and his office, which is really just Gordon Smith. So yeah, we've been working together, and yes, part of our proposal, we had to try to identify um, where are the deficiencies? How can we get people onto a career track that might that might bolster the workforce around recovery? So yes, we did do some studying and some thinking about that, and working with Gordon and DHHS. One of the needs that we have is we need more case management, I think, in uh, you know uh, at substance use disorder treatment agencies. Wellspring, for example, would like to have case managers. Other organizations and agencies would like to have case managers. Um, Case management is reimbursed through Maine Care in the mental health world, but not in the substance use disorder field. So, eh, case management, I think, is one area where there's a need.
Thank you. Um, it's great to know that that collaboration is happening. And I will make a plug for Gordon. He'll be speaking on October 20th as part of our conference at 4 o'clock. He'll be doing a plenary presentation followed by a panel about the opiate response. So I encourage people to attend that.
Yeah,
Doug, you
absolutely.
one additional comment as we wrap up, that this has been one of the best conference presentations one of our listeners has attended. So again, thank you for being here. We really appreciate it. And to those listening, please complete the evaluation and share all of your thoughts there too as well. And Doug we'll be able to share those with you once more come in. Um, this is the last presentation for us today. So thank you everyone for attending this afternoon. We'll be back to wrap up week 2 tomorrow morning, starting at 9 with the presentation on public health data. So we hope everybody joins us then, and that'll be followed by a public health nursing panel. So thanks so much, Doug, and thanks to everybody who's listening and participating. We really appreciate it.
Thank you. Thank you.